All right. Good morning, everyone. If you're able to watch us live, thank you. Good afternoon, good evening, wherever you are. If you're watching the recordings, whether on Facebook or YouTube, thank you so much. This is My Empowered Political Life for June 3rd, 2025. And again, thank you so much to everyone who's been liking, subscribing, and sharing. We appreciate it. It's a super easy, simple, free thing you can do. If you like what we're doing, if you want more people to see it, hitting that like and subscribe button really does help. So thank you so much to everybody who's been doing that. We appreciate it. So today's subject is the GOP cutting healthcare in the new budget. So we've talked a little bit about the budget process before. I'm not going to get into the weeds on the federal budget process, but Congress has failed to pass any long-term budget in a long time. They've kept open the government on a series of what we call CRs, or continuing resolutions. They last anywhere from 3 to 6 months. Right now, we are operating on a CR. There is no federal budget. We're operating on a continuing resolution. Now, Congress has a GOP majority in both houses, as you know, and the GOP is now using a process called reconciliation to pass a tax and spending bill. Reconciliation is something Congress is allowed to do once per year to pass tax and spending legislation on a simple majority vote and bypass any filibuster proof or supermajority requirements. So that's what they're using right now. This reconciliation bill has already passed the House of Representatives, and it is now pending in the United States Senate. Now, the current budget proposes, we're going to focus on the healthcare aspect of it today. We can do the tax aspect in another video. At least $600 billion in cuts to federal healthcare spending, especially on Medicaid. It's going to impose work requirements on Medicaid recipients. It's going to make it harder to apply for Medicaid. They're going to make the application process much more strict and introduce a lot of red tape. It also proposes to roll back protections on the collection of medical debt. There had been protections so that people with a lot of medical debt don't just immediately go bankrupt. It's going to force states to drop coverage in certain situations. It's excuse me. The bill will stop states. Excuse me, kitty cats. I got some fighting kitty cats behind me here. It's going to stop states from using their own funds to cover immigrants or cover expansion and other services that states want to do with their own money. It will limit access to long-term care, and it will allow the ACA, or Affordable Care Act, tax credits to expire. Congress has been renewing those tax credits every year. Now they're going to allow them to expire. So the estimates of the number of people who will lose health insurance has a range. You cannot cut that much money and impose these restrictions without people losing health insurance coverage. On the low end, this is the lowest estimate I've seen, is 9.7 million. The highest estimate I've seen is 14.4 million people losing insurance. And the consensus, the estimate that I see the most, is 13.7 million. And some of these estimates do not include the expiration of ACA tax credits, which will add several million more to the uninsured rules. So we're going to go straight into our popular segment. We haven't done this in a little while. Lies and the lying liars who tell them. So Press Secretary Caroline Leavitt on the bill. The one big beautiful bill also helps get our fiscal house in order by carrying out the largest deficit reduction in nearly 30 years with $1.6 trillion in mandatory savings. Now, to be clear, that is not true. She knows it's not true. Literally nobody believes that's true. The Congressional Budget Office and many other independent analysts put the deficit increase at 3.6 trillion, not a reduction. It's a deficit increase of $3.6 trillion. The Congressional Budget Office is run by Republicans. It's not some sort of Democrat think house. It is run by congressional Republicans right now. So even congressional Republicans admit that they are increasing the debt. President Donald Trump, we're not doing any cutting of anything meaningful. The only thing we're cutting is waste, fraud, and abuse. With Medicaid, waste, fraud, and abuse. Now, there's no evidence that there's $600 billion worth of waste, fraud, and abuse in Medicaid or anything like it. Plus, none of the provisions in the healthcare part of the bill target waste, fraud, or abuse. They directly target the ability of people to get insurance, and keep insurance, and it cuts the funding for their insurance. There is nothing in there about waste, fraud, and abuse. It is all about kicking people off the rolls. Speaker Mike Johnson of the House, Mr. Johnson, we are not cutting Medicaid in this package. There's a lot of misinformation out there about this. Now, that is really, I should say, ballsy of him, of the House Speaker, to say we are not cutting Medicaid. The bill literally cuts $600 billion in funding for Medicaid. So he's got some cojones to go out there and just say that's not true when it's true. We all know it's true. The Office of Management and Budget Director Russell Vaught. Whoops, I got it backwards there. He said no one will lose coverage as a result of this bill. He knows that's not true. We all know that's not true. We all know people are going to lose coverage. Literally every analyst and every estimate of the bill's effect says millions of people will lose coverage. You cannot cut $600 billion from a health insurance program and then say nobody's going to lose coverage, especially when there are specific provisions targeting people's ability to get and keep coverage. Millions of people will lose coverage. All right, so thank you again. Hit that like button, subscribe. It's free, it's easy, it's simple, and it really does help us. Thank you so much, everybody. Let's get into doors and corners. So what are the implications here? A couple of the budget provisions in this bill related to healthcare sound reasonable at first glance. Work requirements for Medicaid. Well, what's the problem with making sure that people on Medicaid are actually working and doing their best? Here's the problem. The vast majority of Medicaid recipients already work, and the rest can't or are sometimes in between jobs. And you will now see people who they lose a job, then they lose their Medicaid before they can get another job. Forcing states to drop coverage for the ineligible. Well, what's wrong with that? If they're ineligible, shouldn't the states drop coverage for them? Here's the problem. Often there are eligibility disputes, and the dispute can take months to resolve. And in the meantime, you're dropped. And often for a lot of folks, they have difficulty proving they're working or proving their income levels because they're self-employed. I used to be on Medicaid. I was self-employed. It was a huge pain to try and keep proving my income levels every 6 months. So a lot of people are going to get dropped who are actually eligible to stay on. And a number of other provisions seem to me to be patently unreasonable, and I don't understand why they're in there. No more protections for medical debt, which means collectors could go after people easier. This doesn't raise money for the federal government. This doesn't save money for the federal government. What is the point of having this in there except to help debt collectors get more money? There's going to be more medical related bankruptcies now. Additional red tape on an already Byzantine system. This is an already very complex system that a lot of people have trouble navigating. And now there's going to be more red tape, which means eligible people are not going to get the coverage they need. Not allowing states to spend their own money on additional programs. Again, this doesn't save the federal government any money, and it doesn't raise any money for the federal government. What is the problem if a state wants to spend their own tax money on additional programs? Shouldn't the state be allowed to do that? I thought we used to believe in states' rights around here. Making it more difficult to get long-term care. Why are we doing that? Why are we cutting off access to long-term care? Now more people are going to have to stay home from work, not work, to give care to elderly family members. This is not going to be a great situation for the economy as a whole. And the expiring ACA tax credit. The entire point of the tax credit under the ACA was to fill a gap. You have people who make too much money to have Medicaid, but not enough to afford what private insurance would cost them in their location. So the ACA tax credit makes up that gap by ensuring they can still afford coverage. Now, this one's important to me especially. If the ACA tax credit expires, then my wife and I will not have insurance next year. The ACA tax credit is what enables us to afford private insurance. We make too much money from Medicaid, but not enough to afford the private insurance in our location and for our age group and health situation and everything else. So the ACA tax credit makes our insurance affordable. If it expires, we may lose our insurance. So as soon as you start thinking this is only affecting other people or those people, think again, it's going to affect people you know. In fact, it's hard to estimate how many people are going to lose coverage because of the expiring ACA tax credit. That's why that's not included in a lot of the estimates of people losing insurance coverage. This could be in the many millions, if not tens of millions. Our quote of the day that I'm going to leave you with, you may have heard this, it's been in the news a lot. Iowa Senator Joni Ernst, we are all going to die. This was her literal response when a constituent pointed out that the Medicaid cuts may lead to people dying, which is a very plausible and likely outcome. He said, we're all going to die. Well, isn't this a bit like a serial killer saying, hey, don't worry, you're just going to die a little early, but you're going to die anyway. Hey, we're all going to die. So let's just take it. I will see you guys soon.